Total knee replacements can be highly successful, life-altering procedures for up to 80% of patients who have them done. However, 20% of patients may have a poor result after surgery. One of the prime causes of unhappy patients following knee replacement is persistent knee stiffness.
Certain patients may be at increased risk of stiffness after surgery. This includes individuals who have had multiple previous surgeries on the knee, a history of stiffness with previous knee replacement, revision surgery, lack of access to physiotherapy after surgery, poor pain tolerance or pain control, and failure to do recommended exercises and stretching.
Other patients will develop stiffness without any risk factors and often despite their best efforts to move the knee after surgery. These patients may have a genetic predisposition to scar tissue formation that we don't understand.
Stiffness after surgery can include the inability to fully bend or straighten the knee. Your surgeon works hard to ensure that most knees have a full range of motion at the conclusion of surgery. And in most cases they do. Stiffness can develop very quickly after surgery, often in the first 2 to 3 weeks, so it's very important to aggressively move your knee early after surgery, before stiffness sets in.
Patients are often afraid to bend their knee after surgery for fear of damaging something or splitting their wound open. This will not happen despite the knee being very swollen and tight. Frequent, vigorous movement is encouraged, and it is important to try and get the knee straight as well as flexed. Over-reliance on pillows under the knee and keeping the knee bent is really discouraged. You really have to push these exercises hard, and it will be difficult.
One of the best strategies for obtaining excellent range of motion after surgery is maintaining optimal pain control. If pain becomes intolerable for a patient, rehabilitation cannot occur, practically speaking. Pain management includes the use of medications, icing, and mindfulness techniques for relaxation.
It's normal to be anxious after surgery. Patients who become over-focused on their pain often don't recover well and may be prone to stiffness or chronic pain.
Home exercises will be given to you as well as instructions from a physiotherapist at your bedside after the procedure. It's important to attend the outpatient hospital clinic to receive assistance with your stretching and exercises. We encourage you to combine these hospital-based sessions with your own private outpatient therapy if you have extended medical benefits or can afford to pay for this service yourself. Some private physiotherapists will also come to your house if that is more convenient.
The goal is to get a minimum of 90 to 95 degrees of flexion by 2 weeks postoperatively, and even more by the 6-week follow-up visit with your surgeon. Patients who are not achieving knee motion goals will be assessed by the surgeon, and a manipulation of the knee may be planned if adequate motion cannot be achieved by the 3-month point.
A knee manipulation is a forceful flexion of the knee under a brief anesthetic in the operating room. Knee manipulations can be effective, but some patients will stiffen up again after the procedure despite their best efforts. In rare cases, revision surgery may be needed to address knee stiffness, but this is quite uncommon.
Ultimately, the entire surgical and rehabilitation team works very hard to achieve the best outcomes for patients that we can. However, a lot of the onus is on the patient to be determined and diligent as an active participant in the process to ensure an optimal result.